Hey, I'm Dr. SCL. I'm a dad, a chiropractor, and the translator you didn't know you needed in this, the first year of parenting. This is Decoded, the first year, the podcast that turns baby brain confusion, mum burnout, and milestone panic into clarity you can actually use. Let's make sense of the chaos by decoding it together. Hey, welcome back to Decoded, the first year. I'm Dr. SCL, and today we're zooming in on 3 of the primitive reflexes you're most likely to see every day, particularly in a newborn. And those are the rooting reflex, the Moro reflex, and the ATNR, or the asymmetrical tonic neck reflex. So let's get straight into it. The rooting reflex, or in other words, you might call it the built-in GPS when it comes to feeding. Now, you've probably seen this. You stroke your baby's cheek and they turn their head with their mouth open, ready to latch. That's the rooting reflex. It's how newborns find food without having to think about it. When it's working well, feeding is easier. If it's overactive, the baby may bob their head constantly and struggle to stay attached. If it's underperforming, they may miss the cues or seem lazy when it comes to feeding, either on the breast or on the bottle. Now, the Moro reflex. Many people will inadvertently call this the startle reflex, and on a technical level, that's not correct. You see, the startle reflex is stimulated by sound. The Moro reflex is technically stimulated by movement. And when that happens, in particular the falling backwards movement, the arms will fly out. They will then come back across the body, together with the eyes suddenly wide opening, and there will most likely even be a cry. Now, this is the baby's built-in alarm system in case of falls. And in the first few months, it's extremely protective. But if it is lingering, particularly beyond about 4 months, you will see an easily startled baby. They have trouble settling, particularly when it comes to sleep and trying to string sleep cycles together. And there may be a complete overreaction to any significant stimulus. Finally, the ATNR, or as you may understand in a moment, the archer. You see, when a baby's head turns to one side, the arm on that side will straighten out, the other arm will bend. It's a significant precursor to the movement patterns involved in rolling, which ultimately leads to crawling, which significantly impacts walking. However, it's also important for early hand-eye coordination, which means it can impact activities particularly of a fine motor control nature, such as handwriting, later in life. So the question is, why would these reflexes stick around or be present when they shouldn't be there? And the easy answer, the repetitive answer, is birth tension, prolonged stress, or developmental overload, which can keep these reflexes inappropriately active. It's not your fault, and it's not about doing more exercises or stretches. It's about helping the nerve system feel safe enough to let these go. Now, I appreciate this may sound repetitive, because it's meant to. Most nervous system stress in bubs can be traced back to in utero stress. In other words, mum was stressed during pregnancy, which, as any mum will confirm, is super hard to minimize, let alone avoid. Birth stress. As we have previously mentioned, even the most natural physiological birth involves significant physical stress on both mum and bub. And life stress. Growing up in a stressful environment can easily trigger a fight or flight response, even in a newborn. And it's very, very hard to grow up in a balanced, symmetrical way if you are constantly on the lookout for a saber-toothed tiger. So what I look for in practice is Every single time I see a bub, I'm checking these and many more of the primitive reflexes. I'm checking movement patterns, and I'm doing that on every assessment. If they're hanging on, the gentle adjustments can help that primitive part of the brain, the brainstem and cerebellum, and help the spinal system reset itself. And once the alarm is turned off, integration of these reflexes can happen easily and naturally. So you don't need to memorize every reflex. Just know the signs and fundamentally, mum, trust your gut if something feels off. This was the second episode of a series on primitive reflexes for Decoded the first year. If this helped you make sense of your baby's movement, tag me at Mount Hawthorn Chiropractic, particularly on Instagram, and I'll see you for episode 3 of this series. Dr. SCL, out. Thanks for listening to Decoded the first year, where we translate the mess of early parenting into something that actually makes sense. Be sure to share this episode with a friend, a partner, or a mum that you know who is quietly struggling through the noise and secretly Googling every milestone. If you want to hear more decoding, follow at Mount Hawthorn Chiropractic on the socials. Let's keep decoding the chaos. No mansplaining, no pressure, no judgment, just clarity when you need it most. Please note, this podcast isn't medical advice. It's just smart strategies from a Gonstead chiropractor, a dad, and someone who's been in the room with hundreds of mums trying to make sense of their baby's development, their own postpartum recovery, and the constant noise that comes with modern parenting. Always chat with your health team for specific care.